Hello, today I'd like to talk to you a bit about tics and Tourette syndrome. What is it? What do they look like? And how can you help? To start off with, what is a tic and what is Tourette syndrome? Ignore my cat in the background. I do apologize for him. Yeah. But to start simply, there is a part of your brain called the basal ganglia, and that is in charge of all of your movements, the words you say, your thoughts, every sound you make, even your breathing and your blinking, all comes from your basal ganglia. Now, what a tic is where your brain is misfiring these signals and it's making you do sounds and movements and even sometimes say words that you don't want to say and you don't mean to say them, but they just come out. So you might have noticed I do have Tourette syndrome myself. I make small movements and sounds, as you can see here. Yeah. I also have a lot of bad words as tics as well, a lot of which I am cutting out for the video, so you will see quite a lot of jumps in the video. Now, I get a lot of questions about my tics, one of which is, do you mean what you say? Now, I can say a lot of mean things as a tic. I don't mean it. I'm not even thinking it. It hasn't even crossed my mind. It just comes out of my mouth. Now, if you're walking in the street, you might pass somebody with Tourette syndrome. Yeah, if you hear them say something quite inappropriate, something that might be a bit mean, that doesn't mean that they are thinking that in any way. Sometimes these things just come out as a tic. Another important question I get asked is, are you born with it or do you just develop it later in life? Yeah. To answer that question, you are born with it. However, it doesn't always show up until later in life. For example, with my case of Tourette syndrome, I didn't start getting tics until about the age of 6. And it wasn't until university, so a long way down the line, that they started getting really bad that I had to seek out a diagnosis. Another thing that people quite often associate with Tourette syndrome and tics is swearing, a lot of bad words and mean things. While, yes, some people with Tourette syndrome do that, it's only a small percentage and a lot smaller than people actually think it is. Yeah, roughly between 10 to 15% of people, which isn't many, have swearing tics. So a lot of the cases of tics and Tourette syndrome that you might see out on the street, you might never realize that is Tourette syndrome. For one person, their case of Tourette's might be a case of blinking, sniffing, and moving their head from side to side. That could be somebody's Tourette syndrome. For somebody else, it could be a lot of swearing words, it could be so many bad things, and it can be so obvious that you don't even need to look for it. Now, what can tics and Tourette syndrome look like? There are many different types of tics out there. However, we tend to categorize them into two different sections. We have motor tics, which are your movement tics, any movement you might see somebody do. Yeah. And we've also got vocal tics. These are your sounds, your words and phrases. Basically, any tic that comes from your throat is considered to be a vocal tic. Now, what should you do if you see somebody with tics? There are a lot of do's and don'ts when it comes to how we treat somebody with tics. For example, we'll start with a list of do's. It's pretty self-explanatory. Things that we do, we treat them normally. They are just the same as you, no different, so do not treat them any differently. Another thing, if you see somebody ticking, just stay calm, don't make a big scene, because it's going to make things a lot worse. Another thing, if you do see somebody with tics and you might have a burning question on your mind, you might be thinking to yourself, what about this? I wonder what the answer to this question might be. If you're curious, ask the question. Don't be afraid to ask questions. We'd prefer you to know more about the condition than to sit there and come up with your own assumptions. Sometimes it might take a little bit longer for somebody with tics to get the point across, to get the words out. So just be patient, do not rush them, because if you start rushing them, you are going to make things a lot worse for them. Yeah. On the other side, we have our don'ts list. These are pretty self-explanatory. Don't stare. If you were walking down the street and you made sounds and movements that you didn't mean to do, and you had people staring at you, you wouldn't like it, so don't do it to them. Yeah. Don't laugh at them. Again, they aren't any different to you. There is no reason to laugh at them. At the end of the day, they can't help what they're doing. So there is no reason to laugh. Do not copy their tics. This is a big one. There's this thing where if you have two people with Tourette's in the same room, their tics tend to bounce off each other. So if one person ticks a word, the other person might then tick that word and they could just keep going around in circles. So if you start to copy their tics, you are going to make the tics 10 times worse than they already were. Don't tell them to stop. Again, this is a really big one. They can't help it. They don't mean to say what they're saying, do what they're doing. So don't tell them to stop because they can't stop. I hope this video has been very informational and I do hope that you have learned something from it. If you do want to learn more, there is charities out there, for example, Tourette Action, who have plenty of resources on their website. Thank you so much for watching, and I hope you have a wonderful rest of your day.